Are you pregnant or a new parent looking to ensure a better postpartum experience? Or are you a birth worker looking to improve your postpartum care skills? Check out Thriving After Birth, an online self-paced course by me, midwife and educator Tanya Tringali. It's 10 and a half hours of video content featuring experts in lactation, mental health, pelvic floor health, pediatric sleep issues. You also get worksheets and a workbook, as well as options to have a one-on-one session with me. Sign up at motherwitmaternity.com/thriving, and let's improve postpartum care together. So today I'm kicking off a birth story series. They won't be all in a row, but they'll be scattered through the rest of this season. There's a specific gimmick here though. Everyone who's participating is a birth worker and is around the age of 65. So part of my fascination with this idea of hearing birth stories with a lot of remove is because I'm a person with a terrible memory. It's actually something I worry a lot about, which I'm sure doesn't help. It was something that was bad for me at a really young age, and people would always say, oh, you're so busy, oh, you're up all night working, that's why. But I've always felt that it's something else. And I'm coming up on 4 years of sleeping every night, and although I can't claim less stress because the entrepreneurial life does not exactly lend itself to less stress, anyway, the long and short of it is that my loved ones tell me stories about my life regularly that I don't remember. Like, not at all. But my birth, which occurred 22 years and 2 days ago, is so seared into my mind. And it's unlike anything else I can conjure in terms of my memories. And I guess I'm interested on some level to know if it's this way for everyone. And I kind of suspect that it is. I'm also interested in the historical details and political climate around birthing issues and midwifery and advocacy in general around the time that the people I'm interviewing will have had their baby. So today, up first, my guest is Julietta Appleton. She is a hypnotherapist, childbirth educator, and doula with a master's degree in public administration. You can actually hear her talk about self-hypnosis for labor and pain management on the Birthful podcast, which I will link in the show notes. She founded the first ever freestanding birthing center in Westchester County, which is the county just north of New York City. It was called The Birth Cottage. She's also written a book that's going to be published sometime this summer, so I will keep you guys in the know. Julietta takes us through a pretty interesting history of things and brings up some interesting medical conditions and various things, so the show notes today will be chock full of interesting things for you. Enjoy. Oh, and a gentle reminder that nothing we discuss on this show should ever be considered medical advice. Please speak to your local provider about anything that comes up in this show that resonates with you and your needs and your healthcare. Thank you so much, Julietta, for joining me today.
You're so welcome, Tanya.
It's been way too long since I've seen you in the flesh, and this will have to suffice, I suppose.
I guess so. I'm missing Clearwater so much, but I don't know when they're going to have it again.
What a loss. I know. I kind of feel like we might be done with Clearwater days.
Could be.
And I imagined that as a part of my life for like many years to come. So it's really bittersweet. I'm obviously going to have to link in the show notes to Clearwater so people know what we're talking about.
Yeah.
But the short version of the answer is that it is a music festival that was started by Pete Seeger a gazillion years ago. And after Pete Seeger passed away, things started to fall apart, and that's its own story. But then, of course, the pandemic hit, and it just seems like this amazing music festival that Julietta and I used to go to together as members of the Hudson Valley Birth Network. Shout out to the Hudson Valley Birth Network. And then I moved to Brooklyn, and I started calling myself the Brooklyn liaison to the Hudson Valley Birth Network.
so that I could keep coming and being part of that. So Clearwater had this like advocacy area, and that's where we were. I mean, that was like where all like the crazy people were, advocacy for all kinds of things, like people who were serious about what they're advocating for. But this was a long weekend of our summers for many years. So anyway,
Yeah.
so Julietta and I are going to miss spending those long weekends together.
Yeah. Yeah.
Now, Julietta, you just turned 70. Is that what just happened?
I did. I can't believe it because I don't feel it, but yeah.
You don't look it either.
Good. Thank you, darling.
Oh boy. Okay. I miss how much you make me laugh. That's definitely something I miss. Okay. Well, okay. So I would love it if you would tell our listeners a little bit about yourself, kind of like your personal details that you're comfortable sharing. And then just to like clue you into what I'm hoping for here, I want our listeners to know about your professional existence, but I know that for everyone who's a birth worker in any capacity, it could be chicken or the egg, right? So I don't want to dictate the order of how this happens. If your professional life grows out of your birth story, feel free to start there, and only go the other way if it's not the case.
Okay. That actually makes a lot of sense to me.
All right, cool.
Yeah, my professional journey definitely arose from my becoming a mom. I had been involved in, of all things, abortion counseling in my early 20s and was driving a van up and down the California coast that said, pregnant, call so-and-so. And I used to walk up and down the beach in Orange County handing out condoms, and people would go, follow that lady. And so...
Wait, so what year is this, Julietta?
This is 1971, maybe.
This is 8 years before I was born.
Oh God, stop it. So mean to me.
No, I feel like an old lady, and all of a sudden I'm like, oh, I'm a spring chicken again.
No. Yes, you were an egg. I'm walking up and down the beach, and they're chasing me because I have free condoms, and I'm trying to get them to understand that there's a resource that they could go to get information about pregnancy and abortion, because it was legal in California at the time. And so then I leave college, I get married, get pregnant, and go, whoa, I don't have as much freedom on the other end of the reproductive spectrum to have my kid the way I want to. And I was living in New York at the time, and I knew I wanted to give birth at home. I didn't want to go to a hospital. So yeah, call me a hippie. And I wanted a midwife. Hi. I couldn't find anybody to catch my baby at home. So then I found out that there was a doctor in California who caught babies in his office, also known as a birth center, but it was really his office with 2 exam rooms set up with double beds. And we moved to California so that I could give birth there. And it was called the Natural Childbirth Institute. Had a great birth, had friends there. My husband was there. My childbirth educator was there as my doula. And it was an awesome, awesome experience. I felt so empowered. And I was home 2.5 hours later. And the pediatrician came to my house and examined the baby. And it was just amazing. And so we moved back to New York a few months later. And I said, I'm going to do this in New York. And it only took me 17 years to get a birth center open in Westchester County, because there was so much opposition. But in the meantime, I had a second kid at Maternity Center Association in Manhattan, which was the first birth center in the country. And it was at the time called the American Association of Birth Centers, but now it's got, it used to be called NAC, the National Association of Childbirth Centers. Now it's the American Association of Birth Centers. And
you're going to send me down quite the rabbit hole in order to make my show notes accurate. This is all stuff that I sort of know, but don't have memorized, of course. And I know where to find it in all the textbooks, but man, you are just like whipping it all out. And then just to like put things in the bigger context, when I had my daughter in 2000, I had her at the Elizabeth Seton Childbearing Center. So which has become a piece of history now too.
Yes, but it was Maternity Center that started Elizabeth Seton.
Yep.
And it's really shameful when you talk about me getting pissed off. It's how many birth centers have closed because of opposition, because, there's this fear that they're not safe. And the statistics absolutely, absolutely disagree with that. It's very, very safe. So don't get me started.
Obstetrical literature twists the data in order to show, the worst neonatal outcomes is infuriating. It's absolutely infuriating.
Right. So I started working on starting the birth center, and in the process of that, got my master's in health administration, became a certified childbirth educator, a doula, and a certified hypnotherapist. And that's what I'm doing most.
Okay, so take me back. Actually, you mentioned when, finishing college, and I realized that I wanted to know what your undergrad was in, but because it's kind of pre all of this happening. So
it was in social ecology, from one of the first programs in the country that had anything like that. And it was fascinating because you could study urban planning and criminal justice and the law and mental health and all these different things that contributed to the homeostasis of humans in their environments, in their ecology. And it impressed me so much that I still remember what they were doing. But, then there was a gap of 10 years between that and getting my master's.
And so how did you end up landing with psychotherapy, which ended up being the thing you've done probably most consistently and for the most number of years of your life, right?
No. I did childbirth education most. And then, so I doulaed, if that's a verb, and was a childbirth educator from 1979 on.
Okay.
And then one of my very close friends, who's known me since I was 17, went to college with me, said, with your voice and with the visual relaxation and guidance that you do, you ought to consider getting certified in hypnotherapy.
Oh, and sorry, I said psychotherapy and you said hypnotherapy.
Very different.
That's, yes, very much different. I misspoke there.
Yeah, although I really would like to get together with that group, Shrinks with Drinks. I'm just putting a shout out right now to you all in the Hudson Valley Birth Network that you ought to consider me, even though I'm not a psychotherapist. So anyway, I started working as a hypnotherapist in 2003. And so being able to use the childbirth education piece that I had and apply it to pregnant women who, believe it or not, Tanya, are anxious. And I know it's a surprise, right? And so a lot, if not 95% of my work is getting pregnant women to trust the cellular wisdom of their bodies and their babies to birth.
Yeah. And I guess what I'm doing these days is picking up where your work leaves off. And I'm trying to help people manage anxiety as they transition into parenthood. And I think you've probably heard me say this, I didn't know when I set out to do this that the bulk of the people coming to me would come to me because they know themselves and they know that they have a tendency towards or an overt diagnosis of anxiety, and they are terrified about what parenthood is going to do to that. So it's so interesting to watch the way we've evolved and the fact that people are waking up to this transition not being what our parents and grandparents led us to believe when we were much younger, right? All of that, like, oh, don't you just love that baby so much? All that, easygoing stuff. And you're like, right? And inside you're dying a little.
I would love that baby if there were 3 other people in the house helping me parent, because, in olden times, like in my mother's era, because she was born in 1911, so long time ago, but everybody lived together. They were in Mountaindale or Ellenville on a farm, and there was my grandma and my grandpa and the aunts and the uncles and all the cousins. So when a baby came into the family, there were arms to hold the kid so you could go take a shower. There were people saying, oh yeah, that's how you breastfeed. Don't worry about it. There was support. And so many people are isolated now, I mean, this is not news, but having nuclear families, and then you both have to go back to work and you have to get childcare. Or I was listening to Lisa Palladino talk about tongue ties, and it's so prevalent now. And she was talking about epigenetics. I have another friend who believes, this is an aside, that it has to do with all the endocrine disruptors that we ingest, because
Yes.
there's also an increased incidence of hypospadias, which
Yes.
is also a frenum issue. And there's a whole lot of midline stuff. So now you're going to have to link to all this. I'm sorry.
No, this is awesome. Julie, okay, I just for our listeners' sake, it is not possible to have a straightforward conversation with Julietta without lots of amazing asides. So just bear with us, because that's how this is going to go.
Sorry.
No, don't apologize. I love this about you. We're going to make it work, and we're going to take everybody on our journey here. So wait a minute. I think this is really interesting. And the second you started to elaborate, I started to get it, because before you even went to like hypospadias, I thought to myself, oh, this is like a really minor defect. I hate to say birth defect and freak everybody out. That's not what I mean to say, but nonetheless, it's this really, really, really minor defect. Hypospadias is when the urethral opening on a penis is misplaced, and it tends to move itself down. And so babies who have this, it is not necessarily dangerous in any major way. They can't be circumcised right away if they're going to be circumcised, and there are corrections for this, and they can be minor to severe, these hypospadias. But what Julietta was saying, and I have to think about this a tiny bit, but kind of the way your tongue and your lips have the frenum, that if you listen to the episode with Lisa Palladino, you learned about that. If not, go back and check that out. It's pulling on things and tightening things up. She's saying that there's possibly a frenum situation that is what ends up pulling that urethra into its malposition. So anyway, it's just all interesting stuff. And endocrine disruptors, meaning chemicals that are getting into our water supply and things like this. This has to do with plastics. This is why anyone who's a birth advocate should also be an environmentalist. Oh boy, we are going down many roads I did not know we would go down today.
Yes, me either.
All right, I'm going to rein you in and
Okay.
say, go back and tell us again. You kind of told us like the setting with which we can envision your birth happening, but I want to take you back and ask you to tell us a little bit about your actual birth story. Like, tell us a little bit about your pregnancy, if there's something interesting there. And then I want to know more about that birth that happened in a doctor's office in California and what you remember about it, because I'm partially fascinated by the fact that, look, 22 years later, I know that my birth is seared into my memory in a very particular kind of way that no other memory in my life is. My theory is that this is the way it is for everyone and forevermore. And so I kind of am curious what details you have hung on to.
Well, I think that idea of it being seared into your memory is probably true for every woman, every person who's ever given birth, because it's so important in terms of creating who you become. Who you maybe didn't even know you were going to become. My pregnancy sucked. I threw up for 9 months, and I had learned a lot about the Bradley method. And
tell our listeners what the Bradley method is.
The Bradley method is called husband coached childbirth. I no longer subscribe to it because he was very offensive to women and called the uterus the baby box and the vagina the baby door, and believed, yes, it's true, Tanya, I see the shock on your face, and believed that women should be stitched up just a little tighter if they tore or had episiotomy.
Ooh, he was an advocate of the husband stitch.
That's what they call it? That's disgusting. Well,
oh, that's an old school name for that. Yeah, we can swap those stories. So I will confess that I never read the book, The Bradley Method. I just think I know what's in it, is basically what it comes down to.
What was important about it and that was most helpful was the idea of progressive relaxation during contractions. And that part absolutely worked. So I got to credit somebody for that, but it was probably Grantley Dick Reed and not Robert Bradley. But the birth was great. I got to the birth center the first time and they said, "You're only 2 centimeters dilated." Sent me home, which would not have happened in a hospital setting. And I came back later and I was 5 centimeters, but I kept vomiting because I was sort of borderline transition. And every time I vomited, I'd dilate a centimeter. So I'd be like, yeah, yay. And soon I was 10 centimeters dilated. And then I pushed for 3 hours. And in the meantime, my friends arrived. There was a 3-week-old baby there in my friend's arms. And there was another friend and the childbirth educator and the midwife and my husband. It was a party. And it was this giant double bed. And it was normal feeling.
Because at the time you were not a birth professional. What was your understanding at the time of why you pushed for 3 hours? Was it just a normal slow primate push? Was the baby OP? Like, what did you know? What do you think now? And does it matter at all?
I don't think it matters, but the Bradley position was to sit on your coccyx, hook your arms under your knees, and pull back. So having an OP baby, which is, sunny side up, and being in this ridiculous position, he ended up, quote, breaking my coccyx while creating room to come out. I couldn't sit right for 3 months after that. So I definitely think it was positional. If my doula had been more helpful, she might have said, get on all fours, and he might have come a lot quicker. But
that's the fun kind of hindsight that I wanted out of birth professionals about recounting their birth story, because I think so many of us have our first baby, which is what leads us to become birth professionals. Like, I long for the day, and it is happening. I mean, I teach in 2 midwifery programs, and so I do see the tide turning. People are coming to midwifery school younger and younger, more often without first children or multiple children even. And that's really different from even when I became a midwife and probably from years past. But it's the fact that when you only have your layperson knowledge to make sense out of your birth, and your provider doesn't debrief your birth with you, which hardly anyone does, and then you have what you have, you tell yourself stories, and those stories aren't necessarily true or factual. And so I find it really interesting when someone can try to remember what they thought about that experience at the time, and then add on, oh, I learned at some point in my education that this is probably what was going on, and how that reframes the story for people.
I think now, well, if I had been doulaing myself, I would have said, turn over or lie on your side if you're tired, because I was tired. But no one suggested that to me, and everybody was so excited that the baby was coming, and they could see him starting to crown, and he did that for quite a while.
And he was in fact born OP.
No, he turned.
Got it. Okay. And do you have any poignant memories? I know you do, of sort of the really early postpartum and then into early motherhood?
Yeah. I had a postpartum depression, which I didn't expect to have, because
Did you know what that postpartum depression was a thing?
Yes,
Okay.
because our childbirth educator had talked about it, but she had only talked about baby blues. She hadn't really talked about, the next level, which was to feel so isolated. I remember calling the warm line at the pediatrician's. And the other thing that I remember is that my son had really crusty eyes, and I wasn't sure what to do about it. And I had a friend who was Mexican who said, oh, just squirt breast milk in his eyes. And I thought, that's really crazy. And then I called the pediatrician, who, do you remember hearing about Heidi Fleiss, the Hollywood madam? I know this is another rabbit hole. Yeah, well, her husband, Paul Fleiss, not her husband, her father, was a pediatrician in LA at the time. And I called his office and I said, my kid has crusty eyes. He's like a week old. I don't know what to do. And he goes, oh, breast milk works really great. It's got natural antibiotic properties. I'm like, oh, cool. Well, this is easy to do. And sure enough, but how fortunate was I to find a pediatrician who believed that, because there weren't that many, that were, and fortunately breastfeeding went so well. I didn't need any assistance with that, but the depression lasted probably a month and was really tough. I would wake up, and my husband would get me tea and get me breakfast and be very helpful. But then when he went off to work, I felt so alone, but I also was active. I mean, on the third day after my son was born, I cooked paella for 6 people. It was just, I felt good and normal physically.
That's fascinating. Yeah, our stories interestingly, there are similarities. I mean, in terms of the birth center experience, I also was sent home 1 centimeter and came back and barfed my brains out and was instantly fully dilated. Like, it was a very similar kind of thing. And then in terms of the postpartum stuff, I mean, I think most people can relate, but as a young New York City mom, the way I combated it, which I didn't even know I was combating something at the time, but I strapped that baby to my chest. I was living in Williamsburg, Brooklyn, strapped that baby to my chest and got myself to Elizabeth Seton every single day for whatever group they had, because I just had to be around other moms and babies. And even that was weirdly isolating because I was 20 and most of the moms were 35 and had like careers and these lives that looked so different from mine. So I didn't really feel like I belonged, but I was at least around other moms and babies. And I needed to see other moms have questions and other moms be frustrated in some ways and struggling with something in order to know that I was normal. And that was my survival mechanism.
Yeah, new moms need community. That's another thing that I have learned from my experiences. We really need to support each other, because when you hear somebody else say something that you've gone through or are going through, there's this, aha, I'm not alone. And I think even if the communities are on Zoom, pandemic or no pandemic, I think just signing on and seeing other people is critical.
Yeah. Yeah. I absolutely agree. So your second baby was born at the maternity center.
Right.
And what year was that?
81.
And so did you have your horrible 9 months of nausea and vomiting the second time?
No, I threw up for 3 months. It was like really sort of typical standard pregnancy. Like at 12 weeks, I was like, can I get some Chinese food, please? I'm starving. And I thought, oh, I'm eating an egg roll. I must be okay. And, the pregnancy was normal. And then when I went into labor, believe it or not, Robin Bradley came with me as my friend and doula.
So just for our listeners' sake, she is someone who should be telling her birth story to me someday soon here. So hopefully you'll hear her. Robin Bradley is one of very few midwives who I credit with having taught me everything I know as a midwife. She's a very special person to me. So, okay, wait, let's take this back. So Robin Bradley was what now?
Robin Bradley at the time was a labor nurse. I also would like to send a shout out to her because she became the first midwife to get hospital privileges in Westchester County, which was pretty damn special.
And was this at White Plains?
At White Plains,
Got it.
Yeah. I think it was 86 or 88, but it was longer than it should have been. But I was in labor, she was a labor nurse, and I said, you're coming with me. So she came to the house and she goes, why are we going now? Because once again, I was eating Chinese food and everybody thought it was too early. I guess I had cravings. Anyway, we got to the birth center and I can't believe I said, I'm going to Miss Dallas, which was on TV at the time. It was popular. Oh, that was around 9 o'clock. And my daughter was born just after midnight. So clearly I knew that it was not too early. And I only pushed for 20 minutes. And it really was a much easier birth. And I went into my head more, kind of letting my body do it. And trusting all the people, the process, just feeling really held. And it was great. And then I didn't go right home because it was a snowstorm. So I went the next morning. But yeah, just
So Robin was with you as a friend support.
right. And so was Jackie Greenfield.
No, I love Jackie. Oh my goodness. I'm going to have to get Jackie to come tell her
her
birth
birth story is
stories.
hilarious.
Oh, but Jackie's always hilarious. Every time I talk to you, I think of Jackie, and I think it's because you're both hilarious.
Thank you. Thank you. But I
I'm
had
gonna reach
Robin
out to
and
Jackie now.
Jackie there, and
Nice.
but Vic
Got it.
Berman and Sally Berman were the founders of this Natural Childbirth Institute, which was really their office and wasn't officially, I mean, it was a birth center, but it wasn't on a list of birth centers. There wasn't that standardization then, you know, and I came back to New York and still tried to find doctors to deliver my daughter at home in Westchester. And I couldn't, I almost got a doctor. And then I found out that he had lost his temper with some client and said, "Oh my God, at the rate you're going, this kid is turning back into an egg." I thought, this is not someone I want catching my baby. So I begged him at maternity.
Are you talking about like finding a doctor to catch your baby outside of a hospital? Like that's almost mythical to me.
No, there were
as a younger
some.
person.
There were some in Westchester. I probably should not mention their names because
Well, we won't do that. We'll let that lie.
yeah. Yeah. I mean, it's really sad to think that they had consequences and had to like work in secret, you know? It's crappy.
So then that means that you really remember that the transition, I guess I'll call it, into there actually being home birth midwives. I mean, when I think about, and I'm talking about New York specifically, just again for our listeners' sake, now we have easy at any given moment 25 midwives floating around the New York City and surrounding regions catching babies at home. And I mean, that is an amazing statistic in this age. So I can't really imagine that we're talking about 40-ish years ago and there being no one. And now, 25 has been a number for quite a long time.
Yeah.
So what do you remember about those transitional years? And I feel like you played a major role in this.
Thank you. And I think I did. I mean, I really fought for midwives to be recognized. I would go to meetings at hospitals when I was getting the birth center started. And then after it was started, I would go around as a consultant to doctors and hospitals, trying to convince them to open out of hospital birth centers, not in hospital. I mean, I know that some of them are in hospitals and they really do keep, I think Elizabeth Seton was one of them that really kept themselves separate from the labor and
Elizabeth Seton was freestanding.
Oh, it was. Okay.
Yeah, okay. It was, you delivered, if you needed the hospital, you went to St. Vincent's just a couple blocks away, okay. But it was its own physical center on 14th Street between 7th and 8th or 8th and 9th. I'm now forgetting exactly where, but West Side. But yeah, totally freestanding and yeah.
Yeah, okay. So our birth center, the birth cottage, was also freestanding, but you could go down a long driveway and then you'd be at the hospital. But there were a lot of quote birth centers that were in hospital and hospitals would brag, "Oh, we've got a birth center and we've got, tubs and whatever," but it's not the same thing. But what I remember about the fight for midwives is that there was always a fight about giving a midwife privileges. So doctors held the control. A hospital could say, "We won't give that doctor privileges here if he supports the midwives, or he or she will not be called in to assist at cesareans," which was, a lot of bread and butter at the time, if not still now. And the home birth midwives were working outside the law for the longest time. Then there was convincing physicians to allow midwives, well, because they had to be overseen. I think the bill, it's still not passed in New York, which gets me crazy about the midwife operated birth centers. It's
Yeah, that
not,
one fell, I think it fell flat in its
Yeah.
last attempt, which might have been 2 years ago now. I
No,
don't
no,
know
no,
if it
no,
happened
it's
again last
recent.
year.
It happened again last year. It's supposed to happen right around the end of the year. And Governor Hochul was pressed to please sign this so that a midwife didn't need the doctor to own and operate a birth center. It could be a midwife who has prescription and delivery privileges all on her own. She's an independent provider, but it has not passed. So midwives who wish to open birth centers still need the doctor to oversee, to be able to have transfer privileges. And sometimes hospitals refuse. And the American Association of Birth Centers stresses that you should be within a half hour of a hospital for transfers. And in some cases, that's just physically impossible. So it might be a 3-hour drive to a hospital. It's so frustrating.
Yeah, definitely. How involved are you at this point in your life, kind of on the political side of things? And I guess just advocacy in that way.
Not as much as I should be. I've offered my services to the birth center that's trying to get started now in the Bronx in Riverdale. But I think they've got a really badass group of people getting it going on their own. Newbie Earth Martin is involved, Mila Flores, I don't know how to pronounce it exactly, but a really cool group of women. And I don't know, here we go, another rabbit hole. Have you seen the movie Aftershock?
Not yet, but our students at NYU actually took it upon themselves to connect with the producers of it. And I think we're going to have a screening at NYU. And so definitely I'm going to get my hands on it here shortly. So
Okay,
anyway,
good.
what about Aftershock?
Well, Aftershock, as you probably have heard, focuses on specifically on 2 women of color who die as a result of the deficiencies and racism in our maternal infant care system. Deaths that absolutely should not have occurred. One woman's platelet count was really, really low, and that should have been noted right away and addressed. And she bled out and died. I think the other woman had an embolism and died, a pulmonary embolism. And it's just so unbelievable. Well, it isn't unbelievable, but the women that were in this film and all the advocates to start a birth center are now on the New York scene, and they're angry and they're fighting, and they've gone before Congress. So I think that we are going to see some changes. And I do think that this birth center will open, but part of the problem, I think, is fundraising, and getting it started. But I'm not as active as I used to be. I feel like the next generation is taking it over, and I'm okay with that. And I'm working in my private practice, and I've been incredibly busy lately working with pregnant women.
Well, that's what I wanted to ask you as we move maybe towards the end of this. Is your practice intended to be exclusively focused on people in the perinatal period? Does it happen part of the time by accident, on purpose? Like what's the evolution of your practice?
I get a lot of referrals from midwives and healthcare providers to work with clients who are really anxious about a specific thing. It might be fear of needles. It might be fear of fainting. I once had a class that had 3 women who were afraid that they would faint when they gave birth, and I said to them, you should be so lucky, that your contractions start and you wake up and you've had the baby. I said, I've never heard of it happening. And if it happens to you, I want to know about it. Have you ever?
I'm telling you, the larger they are as a human, the more likely they are to faint, right? I've looked at many large men and said, hey, I really want you to have a chair nearby, because if you go down, I go from 1 patient to 3 in an instant.
Right. Right. And one of them might be yourself as they take you down in the process.
Yeah,
Yeah.
I have had this happen enough times, right? I'm not claiming it happens all the time and it's such a cliche, but it
Right.
does in fact happen. And it's
Yeah.
not fun when it does.
No, but it doesn't happen to
It
women.
doesn't
giving
happen
birth.
to the birthing person.
As much as she wishes it would. So my practice is mostly pregnant women, and my class is in mind body birth, because I'm not certified as a hypnobirthing person. I sort of object to I don't want to diss it, but I think it's more of a cookie cutter approach than mine. Mine is more individualized in terms of creating affirmations that each partner and person comes up with, not partner, each pregnant person comes up with. And then I also have people referred to me by dermatologists who want their clients to stop nail biting. I had a toenail biter, and that was very interesting, but I fixed him. And yeah, my practice focuses mostly on pregnant people, not because they started for some other reason. They're pregnant, they come to me, they're anxious, and we address fear release and dealing with unwanted sensations and visualize a birth journey that includes unexpected events, because almost all birth, there's something unexpected there. I'm trying to think what else that I do. Well, I've worked with kids a lot lately, which has been really interesting, and I love it. It's so rewarding. And, they're so into magical thinking that they're like, hypnosis, cool,
Yeah, I guess you have some reduced barriers to the whole situation with kids.
Yeah, I think so. They're not prejudiced against hypnosis. And hypnosis is studied, researched in terms of labor. It's been proven to reduce the need for pain medication, to shorten time for labor. There's even a tiny bit of evidence that it improves APGAR scores. And the only reason that I could think that that would be true is that a woman is breathing better and oxygen.
I would argue, because the people that I've seen, I hate to say it this way, but do it really well. I don't mean to say that the people that don't do it well. I'll explain what I mean more in a minute. But the people who have done it really well, first of all, you can't tell where they're at in their labor. You don't see transition the same way. And then, of course, pushing just looks the same. It's really, they're exhaling so much while they're pushing that we know that improves oxygenation to the fetus. So it really makes sense physiologically. But so, okay, I'm going to tell you what I tell patients who ask me about hypnobirthing as a strategy. And I want you to tell me what's wrong with what I'm saying, or just add on to it and explain why, if it happens to be correct. So someone will ask me like, well, what do you think about hypnobirthing? And I say, I think it is just as good as any other method. Knowledge is power. That's the starting place. And then I say, but if I'm going to be honest, I think some people think of it as a magic bullet or a magic trick, and then it doesn't work for a lot of people. And my personal experience is that somewhere in the ballpark of about 1 in 10 people who I've watched, quote unquote, use hypnobirthing. And again, the means with which they studied it vary from person to person. So that's another major variable. But I tend to say that about 1 in 10 surprise me with how incredibly efficacious it is. And there's what I can tell you. So now you decide what makes sense for you.
Okay. Well, statistically, 95% of the population is hypnotizable. So that's a very high percentage. And I test people's hypnotizability by doing a progressive relaxation with them and doing an exercise, visualizing and using all 5 senses to imagine a lemon being cut. And I do this whole thing. And if they salivate, which they most often do, I say, you just created a neurobiological response from a thought. And once they realize that their thoughts can help control stuff, they can relax a little. I don't think that it doesn't work, but I think that people need childbirth education as well as training in hypnosis. And all hypnosis is self-hypnosis. So they don't need somebody there with them to do it. They're doing it themselves. They learn the technique. But my classes in Mind, Body, Birth also teach about the anatomy and physiology of pregnancy, labor, and birth, which then I urge people to forget about. I tell them what's going to go on, and then I say, just trust it. It's going to happen. Just focus on relaxing. And generally, people have calmer, more empowered births. But if they think, oh, this hypnosis is going to work and I don't have to do anything, then you're right. It's probably not going to work
Interesting.
as well for them.
Is there anything else that you want our listeners to know, whether it's, leaving them with one of Julietta's tips, or if it's how to find you or any of that stuff?
Well, you can find me at mindplusbodybirth.com. Any tip? That's putting me on the spot.
Yes, it is.
Let me
I
see.
know you
It's
can handle
okay.
it.
I can. I think I can. Well, one tip that I like to tell everybody is to take 3 slow, deep breaths whenever they're anxious, because it triggers the parasympathetic nervous system to relax and to let you know I'm safe right here, right now. And then everything else can kind of flow from that, any techniques that you might know. But if anybody is freaking out in labor and they haven't studied any hypnosis techniques, even just taking those 3 easy letting go breaths. In new parenthood, putting a baby to the breast, you got a cracked nipple. Instead of tensing up and freaking out, 3 letting go breaths.
Yeah.
I find to be very helpful. Breathing basically is helpful.
Yeah, we have to breathe. You're right. And we have a tendency as humans to forget to breathe. It's pretty wild.
Yeah, it's crazy.
It is.
It's crazy.
We're very
yeah, that's my tip.
complicated, us humans.
I know. I know. And the more we know, the harder it is to give birth. It's like, just let it go and
Yeah.
let it happen. How did it work 150,000 years ago?
Yep.
When there weren't childbirth classes.
Yeah, definitely. Well, like we're coming full circle to where we started. We had people around us all the time, and we were at births from very young ages, and we just were always around it.
Yeah.
That goes a long way.
Well, I think if we can relearn that birth is a normal, natural, physiologic process that doesn't need the medical bells and whistles, except for a very limited part of the time, then I think it becomes easier and easier to birth.
Yeah.
But I think we've got a whole lot of mistrust because of so many things that are wrong in the, dare I say it, male-dominated system.
Absolutely. Yeah.
So we need to overcome that. But God, I'm going to get in so much trouble for saying that.
Yeah,
Maybe not.
It is what it is.
Whatever.
I say a lot of things on this podcast that I'm like, one day, should I be lucky enough that actually a lot of people are listening to this, I might get myself into a whole lot of trouble. Right now, I think my listenership is still small enough that I'm probably preaching to the choir. But
well, let's hope that choir moves forward with the kind of power that they have, because I was just a mom who was pissed off at the system, who worked really hard to gather people together, and I got the right people together on a board, and that group got together and was able to open a birth center. So I think it's possible to channel your energies, and maybe you don't want a birth center. Maybe what you want is more home birth in your community. Then let's hope that your listenership is far flung and can do the good work to get more home birth midwives happening, because there was no option like that when I first wanted to have a baby.
Well, thank you for being an angry mom 44 years ago, because I have no doubt that your actions in the years to follow impacted my professional journey immensely. And I am better for all the work that you have done and all of the people that you influenced that later influenced me. And I'm so grateful that I have you around.
Thank you.
Thank you.
You made me cry. That's not fair.
Hey everyone, it's me, Tanya, your host here at the Mother Wit Podcast. You know I sometimes invite my clients on the show to talk about their birth stories and postpartum experiences, but I want to tell you a little bit more about what those clients and I actually do together. I started Mother Wit to help people in the perinatal period achieve their health and wellness goals. That means whether you're hoping to conceive and struggling with high blood pressure or high blood sugar, or you're having trouble managing anxiety or depression in the postpartum period, or maybe you just need support and advocacy between prenatal or postpartum visits, I can help. Get a discount on your first consultation with me at motherwitmaternity.com using the code FIRSTCONSULT 10% off. That's 10% symbol, all one word. I'm looking forward to working with you and maybe having you on the show too.